Hey parents, Dr. Tony here, and we are here to learn all about ear infections. Specifically, we're going to learn about chronic ear infections, and my little buddy man, Luca, is this amazing kiddo's name. He's going to actually help us learn all about chronic ear infections and how you and your kiddo, if they're struggling with ear infections, can really find natural, drug-free, no antibiotics, no surgeries, solutions to get through this chronic cycle of ear infections and pain and up all night with low-grade fevers and lots of discomfort and pulling on the ears and being sad and having sensory meltdowns and all the things that come with it. So here's the deal. The first thing I wanted to address with this is what's causing ear infections. Now, if you're watching this video because it's inside the article, you maybe just read it all through, and I want to break it down in even more detail. See, the number one way I can explain to you what's causing chronic ear infections, which are just a bunch of acute ear infections that never actually get better. The body never actually rids itself of the congestion and the inflammation and the viruses and the bacteria and all the junk causing the infections. That's chronic by technical standards. If they have them really for 3, 4, 5 months in a row, like Luca did, then that's a chronic ear infection case or recurrent otitis media. The number one thing that causes them is something I can explain back in my Iowa farmer language: poor plumbing, poor drainage. See, I'm going to go right to farmer speak to explain this one to you. The more that something sits around with fluid and water and moisture sitting on it, this is gross, the more that things can grow in there. So if you're a farm kid and you've gone out and you've played in the dirt, you know that mud is more fun than dry dirt because mud has more creatures in it. Mud has more action in it. Well, we don't want creatures. We don't want viruses. We don't want bacteria. We don't want crud and mucus and inflammation building up in our kids' ears or their sinuses or their throats or their lungs. Obviously, that buildup of fluid creates what's called opportunistic infection. Most of the time, they're viruses. That's why antibiotics are so woefully ineffective for most ear infections and really across the board with respiratory infections. So these opportunistic viruses and pathogens that are totally normal to be in our airway, to be in our eustachian tubes, and to be in our respiratory system, they're supposed to be at a certain amount. And as that fluid gets stuck in there, poor plumbing, poor drainage from the inner ear down into the sinuses and the throat and the lymphatics. See, drainage is just supposed to happen from north, top of the head and the ears, to south, through the lungs, through the lymphatics, through the throat, into the lungs. When the lungs then drain into the gut, and the lymphatics especially drain into the gut, and the gut is acidic, so it kills most bad guys off. The gut is supposed to be full of probiotics, part of the conversation here with chronic ear infections, and the good microbiome, so it's supposed to kill all the bad guys off. So as long as we have plumbing and drainage, we do not have ear infections. We do not have recurrent ear infections. So the number one cause of recurrent chronic ear infections is recurrent chronic poor plumbing and congestion of those areas. Then if you throw in teething, seasonal changes, and a common cold, which is called life, pretty much always on the regular for these little ones like Luca, all of a sudden that builds up, creates enough inflammation and irritation, and it fits the medical diagnostic criteria for an ear infection or chronic ear infections. So if poor plumbing and bad drainage is really the number one thing causing then inflammation and irritation. See, everybody thinks it's the inflammation. In the natural health world, they try and target the inflammation. In the medical world, they try and target the viruses and the bacteria. But even we meet families all the time who have made the diet changes, added the supplements, added the probiotics, and maybe actually first medically, they've done the antibiotics, done the fever reducers, then that didn't work. So then they went natural and nutritional, and they've changed the diet, gotten dairy, gotten gluten out of the diet, started to take probiotics, vitamin D, vitamin C, and yet the chronic ear infections remain. That's where it really proves the point that the plumbing is the primary issue. Well, if that's the real cause, is there a cause to the cause? Now hang with me, we got a couple more minutes in this video. We're actually even going to show you Luca's scan so you can see the cause of the cause. So when you hear us write about and talk about in the PX Docs platform, true causes, it's almost kind of like we have to go deeper these days beyond even the words root causes, because a lot of times people will say inflammation and these things that then address it with diet changes and supplementation are getting to the root cause. But if we understand how God really made us, the nervous system is really the system that controls everything including immune system modulation and inflammatory regulation. So what I want to do is dive one notch deeper and tell you there's usually something in the child's case history about 95% of the time with both acute and chronic ear infections. We see that there was a physical jam up, what's called a subluxation, clearly set in motion in a child's case history from either a breech presentation, so their head, neck, and spine and entire body were just jammed in utero and not in the ideal position, or during, really the big one is birth intervention and trauma. We see a high, super high correlation between induction, C-section, vacuum, and especially, my goodness, forceps are almost a guaranteed recipe for ear infections and chronic ear infections and torticollis to boot. Because what happens is those birth interventions create all sorts of physical twisting and pulling on the delicate nerves and muscles and soft tissues and these upper cervical vertebrae and this neurospinal system that involves the cranial bones and the neck bones and even the upper thoracic bones for those lungs and lymphatic drainage we talked about before, because it's got to get all the way out so it doesn't build back up and cause these ear infections and challenges. So what if there is something causing the cause? What if that subluxation, which really can come from breech and in utero positioning or birth trauma and birth intervention, is really the root cause of going on? Well, then to get your kiddo better and to get them to the other side of these chronic ear infections, we got to dig all the way into that true root cause and get to this subluxation. Subluxation has misalignment, which then has fixation, which then affects the plumbing. There's a specific little muscle in here we talked about in our article about chronic ear infections called the, I just have to say in the video because it's a Latin word like most anatomical names and it's so fun to say, tensor veli palatini. And so the palate is next to the eustachian tube and all these things are supposed to move to then move that muscle, and that little muscle is like a little doorway and it opens up the eustachian tube and it lets fluid drain. Well, if this area is subluxated, then the tone or the tension on that tensor veli TVP muscle, tensor veli palatini, gets jammed up, the ears can't drain, they get plumbed up, they get jammed up, they get inflamed, ear infection, and away we go. Let's take a look visually on what that would look like using Luca's scans. So Luca, if you're not watching this on our website, go to pxdocs.com, click on Stories of Hope and Testimonials, and you'll see Luca's story in the ear infection category. He was a real classic chronic ear infections, and he had the tough birth, he had the interventions, he had all the things that were going ahead of this, but let's focus on his inside scans. Now the inside scans right here, we're taking a look, oops, I gotta get this done right here. We're taking a look at what we call a inside scan thermal scan. And so when we look at that right there, that thermal scan is measuring the amount of irritation really within the nervous system. And so everything, both sides of the body, both sides of the spine are supposed to be symmetrical. So anytime we have these huge colors and these huge imbalances, that is a presence of what's called regional dysautonomia. Now hang up on that, don't get hung up on that nerdy term. It's called subluxation. What is subluxation again? Misalignment, fixation, and neurological irritation and interference. So in this case, what we see is we have tons of tension at atlas, the C1 area, and it's all stuck in one direction, creating that misalignment and that tension. And then we see on the other side, what we have with Luca here is we have what's called a counter torque subluxation pattern. Now, counter torque subluxation patterns where C1 and C2 are in disagreement like this and counter torque opposition and tension, they are really the troublemakers. They are not only going to cause the ear infections and a lot of those challenges that come with it, and when I say cause, they are really messing with the neurophysiology of the body so that ear infections set in. And so what's really happening is they'll not only create those sort of challenges and trigger ear infections in those, but they can affect sleep. They can affect mood and sensory processing and regulation, because this whole upper cervical area is air traffic control for the nervous system's regulation of everything. Sensory processing, immune function, and inflammation. The vagus nerve is a nerve that comes in here and it controls the rest and digest, so digestive motility. And a lot of kiddos who have chronic ear infections had chronic colic, constipation, and reflux first when they were littler, and then that grew into chronic ear infections, even though the medical team usually says they'll grow out of these challenges. Kids don't grow out of colic or out of chronic ear infections. They grow into sensory and perfect storm challenges. And again, if you're on the website, check out the perfect storm article or register for that webinar, because it'll really show you how all of this stuff is linked together. But the biggest thing we see with Luca is that there's this massive subluxation stuck in his upper cervical and upper neck region, and the ears and the lymphatics and the sinuses and that tensor villi palatini, so the TVP muscle, and the lymphatics, they all need this to be free of obstruction, free of subluxation and interference, and freely moving to get things freely draining so they don't build up and cause those chronic ear infections and congestion. So per usual, this video went a little bit longer. Every time I set out to do one, I think 5 to 7 minutes should get you all the information you need. But here's the deal. This is your baby. This is your child. And if you've seen your child go through one set of a little bit of teething and a little bit of a cold and be a little bit uncomfortable, we don't like it as parents. And so I had the distinct advantage of being a trained pediatric chiropractor for all 4 of my kids. And I'll tell you, I know this topic inside and out from thousands and thousands of patients over the 15 years of clinical practice, but also the 4 little Ebo kids. I think I added it up. The combined age of my kiddos now is going on like 35 to 40 years total of, kid living. We've had 0 ear infections. Ear infections have nothing to do with genetics. Ear infections do not have to do with short or narrow eustachian tubes. And yes, does our family live clean and have a healthy diet? Sure they do. But the most important thing is we have free and clear or clean functioning nervous systems and eustachian tubes. And when our kids get adjusted, and if we let even the littlest tiniest subluxations can start to trigger the cascade of things like ear infections and respiratory challenges, so our kids are always staying free and clear of subluxation. And that is the ticket. So I also wanted to address the prevention side of ear infections. And if you're getting your kiddos adjusted and living this clean, healthy lifestyle proactively, you're getting way ahead of this poor plumbing, congestion, subluxation, inflammation, and you can stay ahead of it and take care of things before an infection is even having the chance to set up shop and do its thing. So if this video helped you, please share this article, please share this video, please tag someone in it. If you're watching on social media, please text this link out to your mom group, please post it in your holistic local Facebook group. There's somebody, some kid is going to be up at night tonight with their 3rd, 4th, 5th ear infection. They're going to face antibiotics and all the both short and long-standing side effects of that. And that parent, that kid needs this video, needs these articles, needs this help, and needs to find a pediatric chiropractor. Maybe you're still that family with that kiddo. If that's the case, get to our website if you're not there already, pxdocs.com. Click on the directory tab. We've trained hundreds and soon thousands of chiropractors all over the world to use this technology, use our protocols to get the ears draining, to get the nervous system balanced out, and to get kiddos to the other side of this chronic ear infection challenge. God bless. Be well. Hope this helped. Please share. Ask questions below. Send us a DM. However we can help, we're here to do it.